The brain is the most complex organ in the human body, serving as the control center for thought, memory, movement, and emotion. When it is affected by disease, the consequences can be profound, touching every aspect of life. From conditions present at birth to illnesses that develop with age, brain diseases impact millions worldwide. Today, we will explore the major types, their causes, symptoms, and treatments to better understand how they shape health and human experience. Autoimmune brain diseases. Autoimmune brain diseases occur when the body's immune system, which normally protects us from infections, mistakenly attacks healthy cells in the brain and nervous system. This misdirected response leads to inflammation, damage to nerve fibers, and disruption of communication between different parts of the brain. One of the most well-known autoimmune brain diseases is multiple sclerosis. In this condition, the immune system damages the protective covering of nerve fibers, called myelin. When myelin breaks down, signals traveling through the nerves slow down or stop, which can cause symptoms such as muscle weakness, vision problems, difficulty with balance, and fatigue. Another example is autoimmune encephalitis, where the immune system directly attacks the brain itself, leading to confusion, memory problems, seizures, and sometimes changes in personality or behavior. The exact reasons why the immune system turns against the brain are not fully understood, but factors like genetics, infections, and environmental triggers are thought to play a role. Treatment usually focuses on calming the immune system with medications such as corticosteroids, plasma exchange, or immunotherapy, as per the doctor's prescription. While autoimmune brain diseases can be serious, early diagnosis and treatment can reduce damage, manage symptoms, and allow many people to lead meaningful and active lives. Epilepsy. Epilepsy is a chronic brain disorder that causes recurring seizures. A seizure happens when there is sudden, uncontrolled electrical activity in the brain, which disrupts normal communication between nerve cells. These episodes can vary widely. Some people experience brief lapses in awareness, while others may have convulsions, muscle stiffness, or sudden falls. The causes of epilepsy are diverse. In some cases, it results from genetic factors that affect how brain cells send signals. In others, it may follow a head injury, a stroke, a brain infection, or developmental abnormalities. However, for many people with epilepsy, no clear cause is ever found. Epilepsy does not affect everyone in the same way. Some individuals may only have rare, mild seizures, while others face frequent and severe episodes that disrupt daily life. Beyond the physical symptoms, epilepsy can also lead to challenges such as anxiety, depression, and limitations in work or social activities. Treatment is available and effective for many. Doctors prescribe anti-seizure medications as the first line of care, which controls seizures in most patients. When medications are not enough, physicians recommend options such as surgery, nerve stimulation, or specialized diets. With proper management, many people with epilepsy live full, independent lives. Infections of the brain. Brain infections are among the most urgent and dangerous conditions that affect the nervous system. They occur when harmful organisms such as bacteria, viruses, fungi, or parasites invade the brain or its surrounding tissues. The two most common examples are meningitis, an infection of the protective membranes around the brain and spinal cord, and encephalitis, an infection that directly affects brain tissue. The symptoms of brain infections often appear suddenly and can progress quickly. Patients may experience severe headaches, fever, nausea, sensitivity to light, seizures, confusion, or even loss of consciousness. In meningitis, a stiff neck is a classic sign. Because these conditions can become life-threatening in a short time, immediate medical attention is critical. The causes vary depending on the type of infection. Bacterial meningitis, for instance, may spread from ear or sinus infections, while viral encephalitis can result from viruses like herpes simplex or West Nile virus. Treatments depend on the cause. Antibiotics for bacterial infections, antiviral drugs for certain viral cases, or antifungal and antiparasitic medicines are mostly prescribed. Even with successful treatment, some patients may experience lasting effects such as memory problems, hearing loss, or seizures. This is why prevention through vaccines and early medical care remains essential. Mental illnesses. Mental illnesses are brain-related conditions that affect a person's thoughts, emotions, behavior, and overall ability to function in daily life. Unlike physical brain injuries or infections, these conditions are often invisible, but their impact can be just as significant. Common examples include anxiety disorders, depression, bipolar disorder, post-traumatic stress disorder, and schizophrenia. Symptoms vary depending on the condition. Anxiety disorders may cause excessive worry, restlessness, or panic attacks. Depression can bring overwhelming sadness, loss of interest in activities, fatigue, and feelings of hopelessness. Bipolar disorder is marked by alternating episodes of mania, with high energy and impulsive behavior, and depression, with low mood and exhaustion. PTSD can follow trauma, causing flashbacks, nightmares, and heightened stress responses. Schizophrenia involves distorted thinking, hallucinations, or delusions. The causes of mental illness are complex. They often involve a combination of genetic risk, imbalances in brain chemistry, early life experiences, trauma, or ongoing stress. Treatment usually requires a comprehensive approach. Doctors recommend medications such as antidepressants or antipsychotics, therapy, lifestyle changes, and strong social support. Though stigmas still surround mental health, progress in awareness and treatment has allowed millions of people worldwide to manage symptoms, restore stability, and lead meaningful lives. Neurodegenerative diseases. Neurodegenerative diseases are conditions in which nerve cells in the brain gradually break down or die. Unlike infections or injuries that cause sudden damage, these diseases progress slowly, leading to a steady decline in memory, movement, or cognitive abilities. Some of the most well-known examples are Alzheimer's disease, Parkinson's disease, and amyotrophic lateral sclerosis, often called ALS. Alzheimer's disease primarily affects memory and thinking. In its early stages, it causes forgetfulness and difficulty organizing tasks. Over time, it progresses to severe confusion, personality changes, and the inability to perform daily activities. Parkinson's disease mainly affects movement, leading to tremors, muscle stiffness, and slowed motion. ALS, by contrast, attacks the nerve cells that control voluntary muscles, causing weakness that spreads throughout the body, eventually impairing the to speak, move, and breathe. The causes of neurodegenerative diseases are not fully understood. Genetics, environmental exposures, aging, and abnormal protein buildup in the brain are thought to play key roles. At present, there are no cures, but treatments can manage symptoms, slow progression, and improve quality of life. These diseases place heavy burdens not only on patients but also on families and caregivers, making support systems and medical research critically important. Neurodevelopmental disorders. Neurodevelopmental disorders are conditions that begin in early childhood, often before a child enters school, and affect how the brain develops and functions. These disorders influence learning, communication, behavior, and social skills. Unlike diseases that appear later in life, neurodevelopmental disorders shape how a person's brain grows and adapts from the very beginning. Some of the most recognized examples include attention deficit, hyperactivity disorder, ADHD, autism spectrum disorder, ASD, and dyslexia. Children with ADHD may struggle with focus, hyperactivity, or impulsive behavior. Autism spectrum disorder varies widely but often involves challenges with social interaction, communication, and repetitive patterns of behavior. Dyslexia specifically affects reading and language processing, making learning to read and write especially difficult despite normal intelligence. The causes are complex and usually involve a mix of genetics and environmental factors, such as prenatal exposures or early life complications. Neurodevelopmental disorders are not the result of poor parenting or lack of effort by the child. Treatment and support often combine therapies, educational strategies, and sometimes medication. Early intervention is key. With the right resources, many children and adults with neurodevelopmental disorders can thrive, building on their strengths and contributing meaningfully to their communities. Stroke. A stroke occurs when blood flow to part of the brain is suddenly interrupted. Because brain cells rely on a constant supply of oxygen and nutrients carried by blood, even a short disruption can cause damage. There are two main types: ischemic stroke, caused by a blood clot blocking an artery, and hemorrhagic stroke, caused by a blood vessel bursting and bleeding into the brain. Symptoms of stroke appear quickly and should never be ignored. They often include sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, loss of vision, dizziness, or a severe headache. A simple way to remember the warning signs is the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call emergency services. Risk factors include high blood pressure, smoking, diabetes, high cholesterol, obesity, and family history. Age also plays a major role, though strokes can occur in younger people as well. Treatment depends on the type of stroke. For ischemic strokes, doctors usually prescribe clot-busting drugs or surgical procedures, which may restore blood flow, while for hemorrhagic strokes, they recommend controlling bleeding and reducing pressure in the brain. Quick treatment saves lives and reduces long-term disability. Traumatic brain injuries. A traumatic brain injury, often called a TBI, happens when an external force harms the brain. This can result from a blow to the head, a fall, a car accident, sports injuries, or even penetrating wounds like those from bullets or shrapnel. The severity ranges from a mild concussion to life-threatening damage that permanently alters brain function. Mild TB is, such as concussions, may cause headaches, dizziness, confusion, or temporary memory problems. While many people recover fully, repeated concussions can have long-term consequences. Moderate to severe TBIS can lead to loss of consciousness, seizures, speech difficulties, paralysis, or profound changes in thinking, mood, and behavior. In some cases, the injury leads to lifelong disability or even death. The brain is especially vulnerable because it controls every aspect of bodily function. Swelling, bleeding, or bruising inside the skull can increase pressure, worsening the damage. Prompt medical care is critical. Early treatment can stabilize the patient and prevent complications. Recovery often involves a long rehabilitation process, including physical therapy, occupational therapy, and counseling. Even though TBIS can be devastating, many patients regain function and independence with time, support, and treatment tailored to their needs. Brain tumors. A brain tumor is an abnormal growth of cells within the brain. Tumors can be benign, meaning they do not spread to other parts of the body, or malignant, meaning they are cancerous and can grow aggressively. Regardless of type, both can be dangerous because the skull is a closed space. Any growth inside it can press on delicate brain tissue and interfere with normal function. Symptoms depend on the tumor's size and location. Common signs include persistent headaches, nausea, vision or hearing changes, difficulty with balance, memory problems, or seizures. Some tumors grow slowly and cause symptoms over years, while others develop rapidly and produce sudden, severe effects. The causes of brain tumors are not always clear. Genetics, family history, and radiation exposure can play a role, though many cases occur without a known trigger. Treatment is guided by doctors and tailored to each patient's situation. Physicians may recommend surgery to remove as much of the tumor as safely possible. In addition, radiation therapy and chemotherapy are often prescribed to target remaining cancer cells or to slow tumor growth. In recent years, newer approaches such as targeted therapies and immunotherapy have been introduced in certain cases, offering more options than ever before. Outcomes vary. Some benign tumors can be removed completely, while malignant tumors may require ongoing care and monitoring. Brain tumors remain a serious challenge, but advances in medicine continue to improve survival rates and quality of life for patients. Brain diseases are diverse in cause and effect, but they share one truth: they can change lives instantly. Awareness, early recognition, and access to proper care are critical to improving outcomes. Advances in medicine offer hope, but prevention, support, and continued research remain equally important. Each of us can play a role by promoting brain health, challenging stigma, and supporting those affected. Knowledge is the first step, so take this forward, share it, and help build a healthier future. Thank you for watching. If you found this video helpful, please subscribe, like, hype, and share to help spread awareness. I also encourage you to share your own experiences or stories related to any of these brain diseases in the comments below. Better Brain Days.